Hayley M je diplomirani veterinarski tehničar od 1999. godine, dok je 2012. završila specijalizaciju za anesteziju i dobrobit životinja na Univerzitetu u Edinburgu. 7 godina je radila za Animals Asia u Kini. Nakon toga bila je i dio trening programa koje predstavništvo organizuje i koordinira sa veterinarskim fakultetom u Sarajevu. Trenutačno Hayley radi na kreiranju online kursa za veterinarske tehničare za zemlje u razvoju. Danas je Hayley tu sa nama, odlučila je da podijeli svoje vrijeme i svoje znanje, pa evo daćemo podij njoj da nas upozna malo više sa ovom temom. Hayley, can you hear us?
Yes, I can. Hello.
Great. Hi, nice to see you.
You too, Dino. Hi.
I gave them a brief introduction of the topic and of you, so we'll hand it over to you for the presentation. And thank you for being with us.
That's okay. Thank you for asking me. Let me see if I can share my screen. Here we are. To make sure
it's working fine.
Cool.
Yeah.
So can you see which slide can you see from beginning?
We can see the initial one.
And nothing else?
We have all the other slides on the left-hand side. So
it's her screen.
Yes.
Let me just swap presenter view. How's that?
That's okay.
Is that better? You can just see the first slide now.
Yes.
Okay, brilliant. All right, thank you for having me here, Dogs Trust, and thank you everybody for joining. I really hope my English is clear, and if I go too quickly, please let Dino know and interrupt me, and I will try and slow down. I'm quite passionate about this subject of pain, so I might talk a bit too quickly. Okay, so your learning objectives today are how to, by the end of this lecture, you should be able to understand how to recognize and measure pain and the multimodal approach to treating it. Be aware that there are a lot of myths surrounding pain, and I will try and dispel some of those myths. Recognize the welfare implications for not treating pain and what the benefits are to treating pain, because yes, we want the animals to feel good, but there's lots of medical benefits as well. So straight into it, the American Veterinary Medical Association describes pain. Just try and get rid of my picture of myself. No, I can't, never mind. As an unpleasant sensory event and an emotional experience associated with tissue damage and involving the peripheral and central nervous system. So we need to remember that pain isn't just about how the pain feels, but it's also about how it makes you feel as a person or as an animal, how it makes you feel emotionally, because I'm sure you all have experienced pain at some point in your life, and you know that it changes you emotionally when you do have pain. So recognizing pain in dogs. First of all, we will see them usually at the back of the cage or the back of the house. They don't want to be touched. They're hiding. They hurt so much they really don't want to be touched. We might see that they're disinterested in food or their surroundings, so we'll see behavioral changes. And this is where it's important to know what that dog's personality was like before the painful event, so usually the surgery. So we know what its personality was like beforehand, so we know that if any behavioral changes take place after the surgical event. If they're interfering with their wound, licking it or chewing it, or if they're guarding it, every time you try and touch them, they growl at you, that is a sign of pain. Sorry, there's the picture there. If they are in this quite unusual position, we call this the prayer position. This is where a dog will get down on its elbows, bottom up in the air, but the tail will be tucked under. This is not a dog that's asking to be played with. This is a dog suffering from extreme abdominal pain, and this is the only position that it can get comfortable in. Then we might also see dogs with a tense, rigid body posture. They're reluctant or unable to even move because they're in so much pain. So they're just rigid like that, and they are not behaving like a dog at all. So all of these are signs of pain. And often we get that head down, that depressed hang dog look and expression going on. This is something that we can easily spot when we look at a dog in its kennel. Moving on, very often we see squinting of the eyes. the ears are pulled back on the dog and you have a tense face. So ourselves, when we have pain, especially facial pain, we'll really screw our faces up. And we know that human beings who are non-verbal, like babies or the mentally disabled, will easily show these signs of pain, and animals are the same. If we see an altered posture, so where the abdomen is hunched up and the spine is curving like that, just like us, when we have abdominal pain, we crunch up into the fetal position. Dogs will do the same. And often you'll hear vocalizing as well, and that can be anything from a little every now and then to a full-on scream. And if you've ever heard a dog screaming, it is awful experience, and really we must try everything we can never to let our dogs ever get to the screaming stage. Okay, pain in cats, we see a lot of the same body positions, body language that we see in dogs. So if you see hunched up abdomen and the legs very straight, this can be a sign of pain. If we see the slanting or squinty eyes that I talked about in dogs, again, where they pull their eyes back, this can be a sign. Normally with a cat with relaxed eyes, you could draw a straight line from one corner of the eye through to this corner, through to this corner, through to this corner. Usually be a straight line. But with your cats that are quite painful, that line becomes more like a V shape as their eyes get more squinty. They might be recumbent, tense or rigid. Cats really ought to be fluid and floppy. So if you see them really tense like that, that can be a sign of pain. It's very uncat-like to be tense. So that should be ringing alarm bells to us. And if they become aggressive, when initially they weren't aggressive, if they're hissing at you or trying to swipe at you when you go towards them, this is another sign of pain. So again, it's important to know what their personality and character was like before the surgery so that we can recognize any differences at all after the surgery. Staying with cats, if we see those behavioral changes, they're now at the back of the cage, they don't want to be touched, whereas before they were at the front saying hello, happy to be stroked. This can be a sign of pain. If they become disinterested in their food, if they stop grooming, are they not interested in their surroundings, this can be a sign of pain. You can see this black and white cat here. It's dirty all around its face, all down its arms. And the owner brought it in because it had stopped grooming, very sensible owner. And when we opened its mouth, there was a big tumor under its tongue. So those changes in anything that's not normal cat behavior can be a sign of pain or should alert us to be checking for pain. If we see an altered posture, again, we should be taking note. So it might be something very obvious, like this Siamese cat in the picture. This cat's had spinal surgery and its pain is not being controlled at all. But it might be something a bit more subtle. So this cat here was sitting stretched out in the cage, and I thought, casual cat in the vets. But then when I looked again 2 minutes later, the cat was still sitting in that position, and that's not a natural position for a cat in the vet clinic. So I took a photo, and later the cat had x-rays, and we found that there were 2 big tumors in its abdomen causing abdominal discomfort. So noting these subtle changes is very important. If they're vocalizing, and are not calling out for you to say hello to them, then that can be a sign of pain. Cats, they do predate on other animals, but other animals also predate on them. So it's unusual for a cat to call attention to itself. So if it's vocalizing and not in a way of feed me or hello, then we should be paying attention to that. And this video is just a little example. You'll see this cat is in the middle of the cage, so it's not asking for me to stroke it because it's not come to the front. It's standing in a very, very rigid position. It's tension all around its face, and this cat had a leg injury that you might just be able to see on this video. So not a happy cat at all. I should also just take this moment to stress that all of these pictures were taken opportunistically, and all the videos, and wherever I could, I helped the animal after I'd taken the picture or filmed it. Nothing was set up and nothing was purposely inflicted with pain. Okay, some of the descriptors that I've mentioned may be exhibited due to other factors such as stress, illness or fear, and therefore some cannot be reliably used to identify pain. So sometimes we see animals with increased respiratory rates and we might think they're painful, but that could just be because that they are stressed or they're excited or they're hot. So pain recognition, it really can be subjective. Two people seeing the exact same thing can disagree if an animal is painful or not. And I'm sure you've all had this experience with your colleagues. Your age, your gender, your personal health, and your own clinical experience can all impact on determining if an animal is painful or not. So if I was in a classroom with you, I would ask you all now, what do you think of this picture? And you would all have a different opinion, even though you're all seeing the same thing. Some of you would love it, some of you would think it's absolutely rubbish, and some of you would think, it's okay. And that's fine, that's okay to all have a different opinion because you're individuals. And what you see in front of you and how you feel about it is subjective, it's personal to you. But when we're looking at animals and deciding how they are and if they're in pain or not, we can't be subjective and we can't have our own opinion. We need to be objective and we need to be unanimous with what we decide. And it needs to be evidence-based. It can't just be someone more senior than you says, no, it's not painful. This dog gets no pain relief. It has to be evidence-based. And that's what we're going to look at how we can measure pain. So that even if someone more senior than you decides it's not painful, you've got the evidence here to say that it is. And we use something called the short form of the Glasgow Composite Pain Scale. This was created by the University of Glasgow and objectively looks at 6 different areas of where you can measure if an animal is in pain or not. So first of all you have to do is look at the dog in its kennel. You don't touch it, you don't talk to it. And if the dog is quiet, then it scores a 0. We're scoring the dog. If it's crying or whimpering, it scores 1. If it's groaning, it's a 2. And if it's screaming, it gets a 3. So here we're just looking at vocalization. Next, we want to look to see if the animal is ignoring its wound or if it's paying attention to it. If it's ignoring its wound, it's a 0. If it looks at it, it scores a 1. If it licks it, it's a 2. If it's rubbing its wound, it's 3. And if it's chewing its wound or painful area, it's a 4. And here we're just looking at the dog's attention to the wound. Now, in the past, I've had dogs. I've been veterinary nursing for I've been veterinary nursing for 22 years now. And in the past, when I was a very young, inexperienced nurse, I would just put an Elizabethan collar on these dogs and I would have missed a massive sign of pain. That dog was telling me it was painful and it was trying to alleviate its pain by licking it, and all I did was put a collar on it and prevent it from alleviating its pain. It needed more pain relief. It did not need a collar. It's ineffective way of treating pain, and it's also a little bit lazy. We should be looking at treating the pain, not preventing them from licking. Next, if the dog is able to walk, you need to put a lead on the dog and take it out of the kennel. What we're looking at here is the dog's mobility. So if it walks normally, then it scores a 0. If it's lame, it scores 1. If it's slow or reluctant to get up, that's 2. If it's stiff, it's 3. If it refuses to move, then that's a 4. And again, in the past, I've made mistakes. I've tried to get these dogs out the kennels to take them out for the toilet, and they've been really reluctant. And all I've done is I've pulled on the lead and come on, let's go. And I've missed another massive sign of pain. And I'm telling you all these mistakes I've made because I don't want you to make the same mistakes as me. Okay, next part, number 4. If the dog has a wound or a painful area, then you need to apply gentle pressure, just 2 inches, so 5 centimeters around the site of the wound. So here we're looking at response to touch. If the dog does nothing, it's a 0. If the dog looks round at what you're doing, that's a 1. If it flinches, 2. If it growls or guards, that's 3. If it snaps at you, that's 4. And if it cries at what you're doing, that's 5. Some people find this part controversial because they say that you're trying to, you have to cause pain to see if you've got pain. But if you do it gently, it's a good way of measuring. It's not the poke the wound test. It's a reliable way of measuring how much pain is going around that wound. Okay, 2 more questions now. Next, we're looking overall, is the dog happy and content or happy and bouncy? 0. Is the dog quiet? 1. If it's indifferent or non-responsive to its surroundings, that's 2. If it's nervous or anxious or fearful, it scores 3. And if it's depressed or non-responsive to stimulation, that's 4. So there we're looking at demeanor. And finally, we're just looking at the activity of the dog. Is it comfortable? 0. If it's unsettled, 1. If it's restless, moving around, that's 2. Hunched or tense, that's 3. And if it's absolutely rigid, it scores a 4. You add up all those scores. If you've done the whole test where you walk the dog out of the kennel, it's out of 24. And if it scores 6 or more, you need to give more pain relief. If you don't do the one where you take it out the kennel because it can't walk, then you just score it out of 20. And if it scores 5 or more, then you need to give more pain relief. There's no question about this. This is evidence-based. This has been well researched. It's validated pain scoring. And it's the same as when you take the temperature of an animal on the thermometer. The temperature is what it says on the thermometer. So your pain score is what it says after you've done this pain score. And people can't argue. And everybody can do this, nurses, receptionists, vets, members of the public even, because it's so simple and straightforward to do. If you find that when you have scored the dog and it is lower than 5 or 6, but you feel that that dog is painful, your clinical experience tells you that dog is painful, give more pain relief. It's rare that pain relief will be contraindicated in an animal. Obviously, your non-steroidals, yes, you have to be careful with. But for opioids, it's rare that they are contraindicated. And what you need to do is give them a dose of pain and then pain relief, and then rescore them 20 to 30 minutes later and see if that score has gone down. And I guarantee you it probably will have. And if it hasn't, then 1, maybe it wasn't pain, but 2, maybe you've not given the right dose or the right type of pain relief. But we should always be rescoring the dogs after we have given pain relief to check that the score has come down. Now, here is a little video of a dog that's had abdominal surgery 24 hours ago. And here you'll see quite a few pain behaviors being exhibited. This is a young dog that was really friendly before the surgery, and you can see that tucked up abdomen, that curving of the spine. We've got the head down, back of the cage, not wanting to be touched. He's looking away, he's panting. We can't reliably use that as a sign of pain because the dog might just be hot. We've got that tail tucked under. The dog is not settled. He can't get comfortable. He's not lying down. He's not relaxed. He doesn't look like a comfortable dog. And we've got that nose licking as well, which is a sign of anxiety. So this dog is feeling very worried as well as feeling painful. Not a happy dog at all. So this is a video of the dog 20 minutes after I gave intravenous methadone, and I went back to rescore the dog. And this is what we see. So that dog is now comfortable. He's lying down. He's relaxed. We want him to be relaxed and feel better. He's not at the back of the cage anymore. He's interested in what's going on around him. No more nose licking. Happy to be touched. Relaxation of the face. For what it's worth, he's not panting anymore. He just looks like a much more relaxed, calmer, happier, less painful dog. And that's what we should be striving for with our patients. But it's nice to see that comparison video. Now, as Dino said at the beginning, I've worked in Sarajevo quite a lot over the years, and I know that street dogs can behave quite differently to pet dogs. So the free roaming or the street dogs aren't used to being handled, and the Glasgow pain scale really might not be appropriate for them at all. And free roaming dogs, just because they're so scared of being handled by humans, they might exhibit signs of what we would class as pain before the surgery due to being caught and confined. So what we would suggest using for these dogs is facial indicators of pain, and body posture might be a lot more appropriate. So this hasn't been created for all dogs because dog breeds vary face morphology so much. So you've got your flat-faced pugs and your long-nosed greyhounds. We can't use facial scoring for them. But for your street dogs, who all generally look pretty much the same with their nose length and their ear position and their body shape, this is quite a good way of looking at their pain. So here we've got tightening of the eyes. If we've got ear tension or ear flattening, if they're tense around their mouths, we can still use that tucked up abdomen and that curved back. If they've got very rigid limbs, if they're looking at their wound, if they're lowering their head, if they're vocalizing, or if they're reluctant to move, all of those can be telling us that an animal is painful. And this is really useful to use on the street dogs, which I know a lot of you will be treating for Dogs Trust, and perhaps just your own clinics as well. On to cats now. There is a Glasgow pain measuring scale for cats, and what it would like you to do is choose the most appropriate expression from each section and total the scores to calculate the pain score for that cat. If more than one expression applies, then choose the highest score. So first of all, you're just looking at the cat in its cage. If it's silent, purring or meowing, it scores 0. If it's crying, growling or groaning, it's 1. So it's very, very simple. Next, you're looking to see if the cat is relaxed, which would be 0. If it's licking its lips, that's a 1. If it's restless or cowering, ooh, at the back of the cage, that's 2. If it's tense or crouched, 3. If it's rigid or hunched, 4. Next question, if it's ignoring any wound or painful area, 0. If it's paying any attention to the wound whatsoever, whether that's licking it or really chewing at it, it scores a 1. This is quite straightforward, this one. But then you get some pictures and you have to circle the drawing which best depicts the cat's ear position. So number 1 would be ears straight forward, no pain. 0. 1 would be ears slightly out to the side, can't do this, and 2 would be ears right out to the side. And I find it useful just to hold this picture up next to the cat to decide if it's 0, 1 or 2. Next, you're looking at the shape of the cat's muzzle. And circle the drawing which most appears like that of the cat. When I first saw this, I thought, are you joking? There is no difference whatsoever, but there are subtle differences. So cat 0, which is no pain, has a nice round relaxed muzzle. Cat 1, we've got some tightening, and cat 2, it's really quite tense and squashed up. Then you want to approach the cage, call the cat by its name and stroke along the cat's back from its head to its tail. And we all know that lots of cats will usually rise up as it's being stroked. If it does respond like that, it's a 0. If it, ooh, my picture, let me just get rid of that. If it's unresponsive, it scores a 1. And if it's aggressive to you at all, then it scores a 2. Next, question 6, if the cat has a wound or painful area, you apply gentle pressure 5 centimeters around the site. If there is no painful area, apply similar pressure around the hind leg above the knee. So if the cat does nothing, it's a 0. If it swishes its tail or flattens its ears, it's 1. If it cries or hisses, 2. If it growls at you, 3. If it bites or lashes out, then it's 4. And this is where it's really good to know what the cat was like before surgery, because some cats, if they were very friendly and you could stroke them before the surgery, and now they're doing any of these things, then you can really know that that is definitely a painful cat. Okay, final question. General impression, is the cat happy and content? 0, disinterested or quiet? 1, anxious or fearful? 2, dull? 3, depressed or grumpy? 4. Add up your score. The score is out of 20. If the cat scores 5 or higher, you need to give more pain relief. And if you think, if the cat scored lower than a 5, but you know that it is painful, you feel that it is painful, again, give more pain relief. You've got nothing to lose. Go back 20 minutes, 30 minutes later, rescore the cat, and check that your pain relief has been effective. But if you feel that it is painful, give pain relief. This picture just, I think, is helpful in seeing the difference between those faces and ears, pre-methadone and post-methadone. This was a cat that had a nasty tail injury. And so the cat on the left-hand side, this was before we gave the methadone. I would score its ears a 1, and I would probably score its muzzle as a 2. And then if you look at the cat post-methadone, I'd score the ears as a 0, and I'd probably score its muzzle as a 1 for that one. But you can even see the difference in the whisker position. So the cat pre-methadone, the painful cat, the whiskers are more sticking up. But in the post-methadone cat, we've got a nice relaxation of the face as it feels better. When we're looking at our patients in our kennels and their cages, we TPR them regularly. So temperature, pulse, respiration. Add a pain score on at the end. When you get good at them, it takes less than a minute. Have these Glasgow pain scales laminated. You can just Google Glasgow pain scale, cat and dog, print them off the internet and laminate them and have them on your kennel so you don't have to keep printing paperwork each time. Record the finding, inform the vet in charge, or if you are the vet, give you pain relief, and then just wipe them clean afterwards. But even easier still, I would say probably 100% of vets and nurses that I work with all have their mobile phones in their pocket. So why not screenshot it, put it in your favorites, in your photo album, and then when you're with your patient, you can just quickly take out your phone. We can all add up 1s and 2s and 3s. Boom, you've done it. That's it. You've pain scored them, and it was no extra effort at all. But for the animal, it will love it. Okay, so why is pain important? Well, welfare is obviously a major concern for our patients, and ethically, we should be treating pain. But also painful animals will be hypertensive and tachycardic, and we really don't want animals to be hypertensive when we've just spent a long time tying really nice tight ligatures and all those blood vessels. And if we increase that blood pressure, we run the risk of blowing those ligatures off and that lovely clot that had formed now bleeding everywhere. So we really don't want them to be pain just for the success of surgery. There's an increased stress response when an animal is in painful, and when you have lots of circulating cortisol, it decreases your wound healing time. So not only will your wound healing time be decreased because of stress, but when the animal interferes with the wound, it will also decrease the wound healing time as it makes a mess of your wound. It reduces mobility in an animal. So animals that feel pain are often quite rigid and they don't want to move. And then that has a knock-on effect of all the other areas of the body also feeling tense and painful. You've probably all experienced it yourself. Anorexia. Painful animals don't want to eat. And with the best surgery in the world, if you're not eating, you're not getting better. Poor growth and weight gain for painful animals. This is obviously important for puppies and kittens, but also for those livestock animals. So any lambs or calves that need to be going to market really don't need to be painful, otherwise they won't reach their weight. Behavioral changes. So this is an interesting fact. In the UK, I went to a meeting with clinical animal behaviourists, and they were reporting that 70% of the cases they see that the owners were sending to them because there were behavioural problems with the dog or the cat were actually down to pain. 70% of animals with behavioural problems were actually painful. And so it plays a huge part of owner and animal relationships and how the animal fits into the home and the human-animal bond. Depression and sleep disturbances have been reported in humans, so we can assume the same for animals. And this one's interesting. Poorly controlled acute pain, so pain at the time of surgery, if not treated properly, can lead to chronic pain. And this has been reported in humans. And we'll all have heard of phantom limb pain after an amputation. So we definitely need to be treating pain so we don't have all those extra problems. So myths of the last 100 years. A lot of people still believe that pain is beneficial to recovery as it stops the animal from moving around. I'm sure you've all heard this. I used to say it, and I still work with vets and nurses who believe you've got to keep an animal painful after surgery so it doesn't jump around and wreck its wound. Well, pain often makes the animals very unsettled as it tries to get comfortable. So it's not always true, and it is unethical to use pain to restrict an animal. We or the owner should be restricting the animal with kennel and lead exercise. In the UK, we say that all patients post-operatively have to stay on the lead for 10 days until the wound is totally healed. And that includes going out to the garden to go to the toilet. And in the house, we would advise that they block off the stairs and they don't let them jump up onto the beds and the sofa as well, just to be on the safe side. So we don't use pain to restrict animals. Okay, pain is protective. Well, pain does serve a protective role because it alerts an individual to injury from the environment or from within, but protective pain is to prevent us from continuing to hurt ourselves or doing it ever again. So there is a component there of learning. When something hurts, you don't do it again. However, surgical pain is not protective in any way at all. The animal has no way of learning and no way of responding to the painful event because it's anesthetized. As I said, pain is detrimental to an animal's recovery. Surgery is 100% predictably painful, and therefore we need to be treating that pain even whilst the animal is under anesthetic. Okay, if an animal licks its wound, then putting on a buster collar will fix the problem. Well, we know that's not the case because these collars are not magical. The animal will still be in pain, just unable to alleviate the pain in the only way it knows how, which is licking. And there's new research out there to show that placing these collars onto dogs and cats causes quite a lot of anxiety and stress for the animal. And we see behavioral changes in those animals as well, just from wearing that collar. Everything changes for them, the way they're able to eat and sleep and move around, and the way they hear things and see things. It upsets them completely. Okay, quick refresher on pain. The pain pathway begins with the pain receptors, or the nociceptors, which are found throughout the entire body: skin, peritoneum, pleura, periosteum, subchondral bone, joint capsules, blood vessels, muscle tendons, fascia and viscera. So they're absolutely everywhere. And remember, nociceptors are free nerve endings or groups of neural fibers, and they signal the presence of harmful thermal, mechanical, or chemical stimuli. So they meet everything. They respond to everything. And when a noxious stimulus is experienced, three separate processes take place. So I appreciate this as a refresher for you all. Transduction, the nociceptors throughout the whole body, at the site of the painful event, change the chemical, thermal or mechanical energy into electrical impulses. These electrical impulses travel from the site of the painful stimulus to the dorsal horn of the spinal cord and then carry that pain signal on into the brain. So this is transmission. And then we get modulation. So endogenous analgesic systems release naturally occurring analgesics, endorphins, to hinder the processing of stimuli within the spinal dorsal horn cells. So in other words, some analgesic properties naturally reside within the body. Perception is not part of the nociception process, as there are no nociceptors in the brain. Perception is the result of this process. Now, wind-up pain is something that we need to take very, very seriously. So when pain is treated inefficiently, a phenomenon called wind-up occurs. This is the process by which repetitive noxious stimulation bombards the spinal cord with pain signals. The spinal cord is under attack now from these signals. The pain signal that comes into the central nervous system becomes stronger and longer lasting, and there is no way for an anesthetized animal receiving surgery to protect itself from pain. It cannot move away, and therefore there is no way for the animal to prevent wind-up from happening unless we use preemptive analgesia. So this refers to the treatment of pain using analgesic drugs given before the computer's running away with me, given before the introduction of a noxious stimulus. So the drug is given before surgery ever starts. Pain is best managed early and aggressively. It is much more difficult to control pain once it is well established than it is to manage pain before it becomes severe. And we've probably all experienced this when we have a headache. So if you feel the beginning of a headache coming and you take your pain relief drugs, paracetamol, ibuprofen, if you take those before the headache gets worse, you'll normally get rid of that headache. But if you don't take those drugs and you feel a headache coming and allow that headache to develop into a full-blown pounding head and then try and take your pain relief, you are unlikely to get on top of that headache properly, and you'll probably still have a dull background headache. So treating the pain before it starts is far more effective than trying to do rescue analgesia. Preventing pain should be the goal of the analgesia plan. Surgical pain is 100% predictable. If you take a scalpel to something, it will hurt. Reducing the amount of nociceptive input to the spinal cord reduces peripheral and central sensitization, and therefore also reduces peri and post-operative pain. It's an absolute no-brainer that we should give pain relief to make these animals feel better. Preemptive analgesia lessens the intensity and duration of post-operative pain. It decreases the chance of wind-up occurring, and because the different receptors of the pain pathway are blocked before the introduction of a noxious stimulus, the pathway that pain travels on its way to perception in the brain is interrupted, and the pain is not experienced as intensely. Okay, this is an analogy. Imagine the pain receptors are seats in a stadium. Now, all the home team fans, the analgesics depicted here in white, have filled up the seats. This is an analogy for preemptive analgesia. Now, an opposing team fan, a pain signal, he arrives at the stadium and he tries to find a seat. But the home team fans got there early and they prevent the opposing team fan from being able to sit and experience the game. When preemptive analgesia is used, the pain receptors are filled with analgesics that block the pain signals from bombarding the dorsal horn neurons. Relieving pain or rescue analgesia. It is much more difficult than preventing pain, as I said. Once the painful event is perceived, pain signals bombard pain receptors. The pain pathway is now operating without obstruction at all, and analgesics must now block the receptors from receiving the signals and stop the bombardment. So for the analogy, the stadium seats are now filled with opposing team fans, here in red, and the match has started. The home team fan, the white analgesic, must convince an opposing team fan, the red pain signal, to give up its seat. As I said, we've all had that personal experience with headaches, and we know how much harder it is for rescue analgesia to be effective. When we're using preemptive analgesia, or analgesia of any sort, we also want to be using multimodal analgesia. So this is the combining of 2 or more drugs from different drug classes to manage pain. Different drugs act at different sites along the pain pathway to provide optimal analgesia, and because they're different classes of drugs, they can be safely used together. And combining different classes of analgesic drugs ensures a more effective and enhanced management of pain. This synergistic effect occurs, and therefore lower dose of drugs can be used, reducing the possibility of side effects. Again, it's a win-win for the animal. So drugs commonly used in preemptive analgesia, we're getting to the end of this lecture now. Drugs commonly used are local anesthetics. So these block impulse conduction in nerve impulses. They're cheap, they're readily available, they're extremely effective when used correctly, but they are often underused. So I'm sure lots of us here have had local anesthetic. Absolutely nothing gets to the brain to tell you that pain is happening. If you've ever had a tooth out at the dentist, hit your face afterwards, you feel nothing. Extremely underused, extremely effective when used correctly. So we're looking at lidocaine and bupivacaine there. Ketamine is a great drug, and I know it's readily available in Bosnia, and it helps to prevent the wind-up phenomenon. It helps potentiate post-operative pain analgesics, so helps the other pain relief that you've given to work better, and is a very useful drug in patients undergoing major surgery where a chronic pain state is at risk. So as I said, pain that's not treated appropriately at the time of surgery runs the risk of becoming chronic pain in a human. We can assume the same for animals. So ketamine is a great drug for that. Opioids decrease the perception of pain the reaction to pain, and also increase pain tolerance. So whereas some pain, it doesn't take away pain completely, not like a local anesthetic, but it makes pain that would have been utterly unbearable, it makes it much more bearable. So opioids bind to the opioid receptors in the nervous system, inhibiting the release of excitatory neurotransmitters in the brain and spinal cord, thereby reducing the pain from a noxious stimulus without interfering with motor function. Here are your examples of your opioids: morphine, pethidine, methadone, buprenorphine, fentanyl, butorphanol, and tramadol, just to name a few. Non-steroidal anti-inflammatory drugs exert antipyretic and anti-inflammatory and analgesic effects, your carprofen and your meloxicam. And then finally, paracetamol, not considered a non-steroidal because it doesn't exhibit significant anti-inflammatory activity on COX-1 or 2. It's good for head trauma patients as it reduces the amount of opioids needed. Opioids can reduce respiratory rate, which increases CO2, which can increase intracranial pressure, so it is a great drug. Only for dogs. Do not use paracetamol in cats, it will kill them. If you've got dogs with severe kidney disease or gastrointestinal upset and you can't and don't want to give them non-steroidals, give them paracetamol. We often see a real improvement in a dog that's had paracetamol. But remember, you can give a non-steroidal and you think, I do think he is still a bit painful. Add in some paracetamol. Often you see these dogs totally relaxed. And I think we don't use paracetamol very much because we think of this bigger and better drugs out there than paracetamol. Again, only for dogs. And because it's so cheap and readily available to us and we use it all the time, we don't think about it being a really effective drug, but it is, and it really can help our canine patients when they are feeling painful and we've just not given them quite enough of the right drug. This was a great picture. This presentation has been recorded, so you can probably go back and look at this. But this just shows you how all those different drugs, at which point along the pain pathway all those different drugs work. And you can go back to this picture and study this because I'm running out of time. But the one thing I wanted to finish with, if you're using a pre-med, which should have an opioid and a sedative in it, propofol or alfaxalone or thio, and gas anesthesia, then being able to tell the difference between light anesthesia and adequate anesthesia, but where the animal is painful, is very important. Now, this won't be significant, this won't be relevant to those of you that are using xylazine and ketamine, because I know with those you often have them blinking as well. But if you're using propofol and gas anesthesia, what you're looking for an animal that's too lightly anesthetized is they'll have a central eye position, and we want them to have a ventral medial eye position. They might be blinking, they might have a very tight jaw, they might be swallowing. Oops. They might, God forbid, be moving or vocalizing. If you've got all of those things and an increase in heart rate, blood pressure, and respiratory rates, oops, this has gone the wrong way around, then you need to give more anesthetic. So you can either turn up the gas or you can give another injection of propofol, whichever is more urgent. If they're moving or vocalizing, IV, intravenous propofol. If they're doing a bit of blinking or so the eye position is moved, then you can probably just turn up the gas. But if you've got an animal that is adequately anesthetized, you'll see a nice ventral eye position. There'll be no blinking. Jaw tone will be nice and relaxed. They won't be swallowing. They won't be moving, and they certainly won't be vocalizing. And if you've got all that, and then you see an increase in heart rate, blood pressure, and respiratory rate, that's when you give more analgesic. Turning up the gas, there's no need to turn up the gas. The animal is adequately anesthetized. You need to give more analgesia. So have a look at what you've already given the animal, work out if it can have some more of that or if you need to add in a different drug. That's it. I have almost finished, but what I wanted to finish with, I work for the University of Edinburgh still. And we have nearly finished creating, this has already gone live, a veterinary nursing skills online resource. So if any of you out there are training veterinary nurses or are veterinary nurses or student veterinary nurses or technicians, this is a really great resource. It's totally free. created by me and a small team at the University of Edinburgh. There will be some useful bits in here about animal behaviour as well, if any vets would like to visit the site, or if any of you are teaching, then this is an extremely useful resource. You just sign up with your name, the country that you're from. It's all completely free. There's videos, there's lots of photos, there's lots of documents, there's multiple choice questions so you can test yourself, and there's links to lots of other resources. So this is a really good resource which we would love you to sign up for and love you to use, and give me any feedback as well. Be great. So to summarize, learn how to recognize signs of pain in your patients, know what they were like before the surgery, use preemptive multimodal analgesia to target pain at different points. Pain is 100% predictable with surgery. Use the Glasgow pain scales to objectively measure how painful your patients are. Treat your patient, check your patient again, revise your analgesia plan as necessary. TPRPS, temperature, pulse, respiration, pain score. And if you are in any doubt if an animal is painful or not, give a test dose. What have you got to lose? Thank you very much. I hope you understood me, and I hope that was useful. Thank you.
Hayley, thank you so much for this presentation. It was wonderful. We have a few questions for you. Is it okay if we continue immediately to the questions?
Yeah, sure.
Okay, we'll start from the first one that we received. One of the colleagues asked, can we give human painkillers to our dogs?
So you can give paracetamol to dogs, but that would probably be the only one I would be recommending. Human drugs are often have different ingredients in them that would be allergic or detrimental to a dog's health. So paracetamol would be your only dog that you would give, a drug that you would give to an animal, and that is at 10 milligrams per kilogram, usually twice a day. But obviously you want to make sure there's no liver complaints going on with that dog.
Thank you. The next one. Is it hard to distinguish aggressive animals or other animals with behavioral changes from animals in pain?
Yes, it can be quite difficult. And so again, it's about speaking to the owner and asking the owner if there's behavioral changes in the dog or the cat. They'll know that if the dog has suddenly become aggressive, very often there is a medical problem going on with that dog, arthritis or an endocrine problem or something like that. But if it's a dog off the streets and it's behaving aggressively, was it behaving aggressively before the surgery? And is it now still behaving aggressively? But as I said before, if you are in any doubt whatsoever, just give more pain relief, and then it rules out pain being a cause of the aggression.
Thank you. The next one, are there any home remedies we can use to relieve our pet's pain?
Yes, there are, and I didn't mention them. So it should never be underestimated. I think you're asking about drugs, but what shouldn't be underestimated is how important a comfortable bed is. When we're all painful, we want a really comfortable bed. We want a nice quiet environment. We want gentle handling and quiet talking and slow stroking. Can you still see me? Is my camera still on?
Yes, we can see.
Okay, I can't see myself, that's all. Dim lighting will help. Being hand-fed food, so you don't have to get up and get to the food if you're painful. All of these things can help make a big difference. But as I said, the only real home remedy would be paracetamol. But again, I wouldn't be relying on paracetamol as my sole pain relief. That tends to be one that you would add into something else to just help the analgesia that you've already given. But yeah, never underestimate the nursing care being a massive tool in helping alleviate pain in patients. Oh, the other thing is when you do have your patients in and you're giving them constant injectable analgesia, make sure you've got an intravenous line in, because you'll be upsetting them each time you put the injection into their muscle or into their scruff. Most analgesics can go intravenously, so make sure you've got a comfortable IV cannula placed.
And one for the end, if a dog has elevated liver enzymes and kidney damage, what do we have to take special notice of when we're giving them pain relief?
Well, I would always do a baseline blood test for those animals. And if they are unable to have our traditional non-steroidals or traditional paracetamol, then you can be looking at drugs like gabapentin, I don't know if you have that available in Bosnia. That can really help. There's other things as well. It depends what's causing the pain. That would be the problem. But opioids can obviously be massively effective for those animals as well. I'd have to know about the individual case to be able to know what analgesia I'd be recommending for those animals.
Okay, Hayley, I see no other questions here. Again, thank you very much for being with us and for sharing your knowledge with us.
No problem.
If you don't mind, I'll just sum up today's seminar with everyone in Bosnian, and then we'll call it a day.
Okay, I'll say bye now then. Thank you. All right, bye everyone. Thanks.
Bye.
Thanks, Dino. Bye.
Thanks, Hayley.
Bye. Bye.
Bye.
Dragi svi, evo da zaključimo današnji seminar i od mene hvala vam puno što ste izdvojili vaše dragocjeno vrijeme da budete danas sa nama. Pratite naše društvene medije, našu web stranicu. Planiramo već i naredne sedmice da imamo 2 seminara za vas, jedan u srijedu i jedan u petak. I naravno, evo, dobrodošli ste da dajete vaše prijedloge na naš mail adresu office@dogstrust.ba. Još jednom hvala vam najljepša i svako dobro.